Good afternoon, everyone. Thank you for being here. We'll just wait as people join the webinar. Wait a few minutes. All right, good afternoon, everyone. My name is Dr. Margaret Tando. I am the Associate Dean for Inclusive Excellence at the Larner College of Medicine here at the University of Vermont. It's my privilege to welcome you to the 2025 Black Health Story Month lecture. As many of you know, each February, the U.S. celebrates Black History Month to recognize the contributions and achievements that Black people have made to the advancement of human civilization throughout history. Black Health Story Month aims to present a fuller history of Black health in the U.S. by highlighting the long history fight for health justice and advocacy for African Americans by African Americans. By examining this history and its potential present-day manifestations in healthcare, we are able to comprehend the factors that can lead to change and better health. The Black Health Story Month initiative is a collaboration between the Larner College of Medicine, the College of Nursing and Health Sciences, and the UVM Health Network, and is designed to provide space for education, reflection, and engagement across the academic medical campus. And we invite units from across the academic medical campus to join us in creating content and events within their spaces that align with the theme. We're hoping that throughout the year, as we have various federal months designation, like Mental Health Awareness Month, Women's Health Month, Men's Health Month, we're hoping to have those as mental health story, and have the health story have themes throughout the year. Before we get started, though, there are a few housekeeping items I need to go over with you. A live captioning link is available in the chat. And the lecture is also CMIE accredited this year. You can scan the QRS codes in the presentation for the evaluation and the link to create credit. These links will be added to the online chat as well. Lastly, there is no financial relationship from the speaker that need to be disclosed to the audience. Now I have the honor of introducing our 2025 Black Health Story Month lecturer, Dr. Preston Reynolds. Dr. Reynolds is a professor of medicine at the University of Virginia, specializing in general, geriatric, palliative, and hospital medicine, and currently serves as the Associate Chair for Professionalism and Diversity for the Department of Medicine. She earned her MD degree from Duke University and completed her residency training at Johns Hopkins. For over 30 years, Dr. Reynolds has focused her research on the history of racial discrimination in healthcare and medical education. She has published and lectured extensively on the teaching and assessment of medical professionalism and ethics, the history of racial integration in American medicine, and the contributions of African American health professionals. She is the author of the Durham's Lincoln Hospital, a book chronicling the history of Durham, North Carolina's historic Black hospital. More recently, Dr. Reynolds' work has been involved in bringing genetics into generalist practice and national policy efforts to reform healthcare in the U.S. In addition to her academic roles, Dr. Reynolds served on the board of directors for Physicians for Human Rights from 1987 to 2002. During her tenure, she helped develop PHR's Human Rights Investigative Research Program, contributing to the organization's international recognition and its receipt of the 1997 Nobel Peace Prize for its work on the health impact of landmines. Dr. Reynolds has not only advanced the field of medicine, but also fostered a more inclusive and respectful environment for all members of the medical community. Please join me in welcoming Dr. Preston Reynolds. Thank you.
So I have to share my slides. Here they are. Okay. So we have a lot to go through today. I actually teach a semester course on the history of African Americans in the health professions.
Hey, Dr. Reynolds, sorry to interrupt. We're actually seeing unfortunately, we're seeing the notes view there.
So just hit the display settings.
Yeah, that little caret right next to the S in settings on display settings. Hit that, and then it'll say swap.
Okay, so I did that.
Try that one more time. Click that, and then swappers. There you go, right there.
You're good? You're good?
Not yet. No, still seeing the notes view. Did you have it open when we started? You may need to close it and just restart it. That may work better.
What about this?
There you go.
Thank you.
Okay, great.
Perfect.
So I actually teach a semester course on the history of African Americans in the health professions, focusing on the history of African American physicians, nurses, dentists, public health professionals, from the Civil War all the way to the present. So normally the space that I work in is actually what you're dedicated to highlighting this entire month, which is the really remarkable history of African Americans in the health professions. We're going to focus on a sliver of that history, but I want you to understand that this sliver of history really foundationally is rooted in the contributions of African American physicians, dentists, and nurses. And we'll talk a bit about some of those individuals. We cannot understand the racial integration of hospitals without understanding that it is embedded in what I call the perfect storm. The perfect storm being the civil rights movement, the election of JFK, as well as his death and the move into the presidency of Lyndon B. Johnson, followed by the passage of Medicare. Those three things were really critical to transform healthcare in this country from what had historically and for centuries been segregated healthcare and the denial of basic access to African Americans and other minorities. So as we see here, these are just some of the highlights of that civil rights movement that some people say started in the 1930s and 40s. But we see it in 1954 with the Brown versus Board of Education Act. In 1960, JFK is elected. In 1963, he introduces his civil rights bill, and he is elected on a platform of advancing civil rights. And many people do think that the contributions of Black voters were instrumental in him getting over the top and actually winning that election. But in November of 1963, he is assassinated. 5 days later, Vice President, now President Lyndon Johnson, addresses Congress and calls on the House and the Senate to honor the slain president by passing two critical pieces of legislation. One, his civil rights bill, and one was legislation guaranteeing health care for the elderly or people over 65. Now, I like to say that hospital integration started with a group of really instrumental Black medical leaders. Louis Wright was a graduate of Harvard Medical School in 1915. He graduated and graduated fourth in his class, but was not allowed to march in academic rank because he was Black. He was nominated for AOA by the dean of Harvard, but was refused admission because he was blackballed by a white student from Tennessee. He is a powerful intellect. He is intellectually brilliant, achieving really remarkable research as a medical student. He goes to Harvard, continues to do research, but he also is an activist. Both of his grandfathers were white. One of his fathers, his first father died. His second father became a founding member of the National Medical Association in 1895. Louis Wright assumes the role of chair of the board of the NAACP in 1934 and stays in that role until 1952. He also is surgeon at Harlem Hospital and rises within the rank of the surgeons in that hospital to the role of chief of surgery. He's also on the New York Police Department surgical physician force. So he is a powerhouse politically, intellectually, as well as medically. And then you've got Montague Cobb, Paul Corneli, and Leonidas Berry. Leonidas Berry is working in Chicago through his connections as a gastroenterologist. Montague Cobb is a MD PhD with his PhD in comparative anatomy and understands the normal evolution of people being from all 10,000 people that migrate out of Africa thousands of years ago. Paul Corneli becomes an expert in public health, and we'll talk about these individuals a little bit more. When Louis Wright graduated from Harvard, he was denied admission into every residency training program in Boston simply because he was Black. So his personal background of brilliant academic achievement, his personal experience with discrimination at Harvard, made him really a powerful spokesperson for the racial integration of hospitals and medical schools throughout the country during his tenure as chair of the board of the NAACP. Montague Cobb, as I said, was an MD PhD. His background as an anatomist was in comparative anatomy, and he was offered the opportunity by Louis Wright to serve the NAACP and to do some research on the impact of discrimination on the health and the advancement of the Black medical profession. Similar to Louis Wright, Montague Cobb was a brilliant intellect. And so he took this charge with enormous fervor and published 2 huge monographs that detailed in exquisite analysis the impact of discrimination, what I call white medical supremacy, on the healthcare not only of African Americans, but on Black health professionals themselves. Paul Corneli was born in Jamaica. His family moves to America, and he gets his undergraduate, his master's degree, his medical degree, and his PhD from the University of Michigan. He's the first African American to graduate with all those degrees from the University of Michigan. He takes his expertise, becomes chair of community and preventive medicine at Howard, and starts doing health services research on the impact of discrimination on Black individuals around the country. He ascended to become the first Black African American elected as president of the American Public Health Association. So, as I said, we are coming into the height of the civil rights movement. And Paul Corneli starts doing surveys. He does surveys through the National Urban League chapters. These are biracial groups of individuals, largely in the South. And he sends National Urban League chapters a survey to send to their hospitals in their cities. And he finds that hospital discrimination is widespread, particularly in the South. What does it look like? And these come from Duke Endowment reports. In the back of a Duke Endowment report, we have architectural designs of hospitals that the Duke Endowment is supporting. Here you have an all-Black hospital, like Lincoln Hospital in Durham. There were hospitals in North and South Carolina supported by the Duke Endowment that did nothing but admit Blacks to their hospitals. They also allowed Black doctors, admitting privileges, and this was a place for Black nurses to be employed. Then there was the typical segregated hospital, and this is what was expanded post-World War II with the use of federal Health-Burton funds. Many communities built segregated hospitals with separate outpatient and separate inpatient wards for only African Americans. The problem is that some of these wards were buildings behind a hospital, or they were attics, or they were basements. And these basement wards, like what University of Virginia had until the late 1950s, were dark, damp, often located next to dumping grounds outside hospitals. Some of them in the South only had screens and had only maybe one toilet facility and very poor lighting. And people had to be carried outside to go from this black corridor into the hospital for radiology, surgery, or the delivery of their child. One of the things that this group of Black physicians organizes, and I will go back and show you these individuals together, organized the InHopeTep conference. It was spearheaded by Montague Cobb and Paul Corneli, both of whom were on faculty at Howard University. And they set out to bring together African American physicians as well as politicians in the Washington area. And they wanted Black physicians to come and talk about how the federal government's expansion of hospitals with federal funding under Hill-Burton had created a super deluxe Jim Crow. Because here were communities passing bond issues, putting money into building hospitals, but then those hospitals were opened and they were still denying Blacks admitting privileges to care for their patients inside these new hospitals. Paul Corneli, who, as I told you, in public health and part of the American Public Health Association, calls for an activist agenda. And he calls for a use of an activist agenda to overthrow the federal government's Hill-Burton program. Cobb, who by this point has ascended to serve as editor of the Journal of the National Medical Association, carves out one entire column of JNMA dedicated nothing but stories about the effort to racially integrate hospitals in the North and the South and the efforts of Black physicians to change the landscape of healthcare in this country. At the same time, we still have the NAACP Legal Defense and Education Fund. This is the arm of the NAACP that's litigating Brown versus Board of Education. And they're looking for cases all throughout the landscape of discrimination that will meet the Constitution's right to access to free care and free services, equal services and equal care. Now, part of that landscape is being shaped by Howard University's School of Law. And I take us to Conrad Pearson, who is a lawyer raised in Durham, goes back to Durham. But interestingly, he's a graduate of Howard Law School in the same class as Thurgood Marshall. The dean of that law school decides to use his classroom to create a network of constitutional lawyers that will go out throughout the rest of the country and start bringing forward cases that will overturn what at that point was legal segregation by saying that segregation was unconstitutional under the 5th and 14th Amendment of the Constitution. And Comrade Ed Pearson is actually the first lawyer to submit into the courts a case against discrimination in higher education when his client, Holcott, applied to become the first pharmacy student at the University of North Carolina. He then goes on and says, well, another area of discrimination is hospitals. And he submits into the federal court system, which is district, circuit, Supreme Court. He submits a case to say that this hospital in Wilmington, North Carolina, James Walker, is violating the Constitution because it's discriminating against Black physicians who want to take care of their patients there, even though James Walker has a Black ward, which was that building behind the hospital. It wouldn't admit Black physicians to care for their patients in that hospital. So as you can see, the district judge dismisses it, the circuit court dismisses it, but it gets to the Supreme Court, and the Supreme Court has 3 dissents. And one of those dissents is Chief Justice Earl Warren. And what does the NAACP say? He said, oh my gosh, we have a case here, but we have to find what we call that perfect test case. So they weren't at all discouraged. They were encouraged. They just needed to find the right elements that would make it through the federal court system. Long story short, along comes George Simpkins, who was a dentist, and he was an activist. He had been chair of the local Greensboro NAACP chapter. He had racially integrated the golf courses and the public schools, and he wanted access to the White Hospital in Greensboro because his patient who had impacted molar, he couldn't get a bed at the Black hospital, but the White Hospital wouldn't give him admitting privileges. So he calls up his colleagues at the NAACP and says, I really need some help. Can you guys help me? And lo and behold, they ask him to get other plaintiffs. So he recruits 5 African American doctors, 3 dentists, and 2 African American patients, and they file a class action suit against these 2 hospitals in Wilmington, North Carolina. And the key is that both hospitals had used federal funds in 4 expansion programs, as you see here. And as you also see, North Carolina had received $180 million in 300 different Hill-Burton federal projects. And the key was crafted by a young associate of the NAACP Legal Defense Fund who argued, we can't argue this case around inequality of facilities. We have to argue for non-discrimination based on state action. That is a really critical legal principle that only lawyers would know, but state action meant that there was federal oversight in these hospitals because they had used Hill-Burton funds. Those funds had to be approved by the U.S. Surgeon General's office. And so sure enough, the Legal Defense Fund team files in the district court. It gets dismissed. But at the Fourth Circuit Court, they said your argument is correct. And we will say that yes, the plaintiffs, the African American physicians, dentists, patients should have access to these previously all-white hospitals. And these hospitals should admit these Black professionals for admitting privileges, and that you should receive protection against discrimination against the 5th and the 14th Amendment. So these are the 15th and 14th Amendment. I will not go through them now, but I'll encourage you to pick up your little copy of the Constitution and read them. These are often the provisions of the amendment that are used in civil rights litigation. So the NAACP says, wow, we've won, but This only applies to hospitals in the Fourth Circuit. Fourth Circuit being West Virginia, North Carolina, South Carolina, DC, and Virginia. So they're saying in order to expand our reach, just like the Brown versus Board of Education, which is a composite of cases put forward in different jurisdictions, they said, let's file similar cases around the country and then go to the Supreme Court. But in the interim, the people who lost in Greensboro said, "Oh, we're going to send this to the Supreme Court and have the Supreme Court say, your argument is all false." Well, the Supreme Court said, "No, your argument is correct." And because they denied writ of certiorari, which is the decision not to hear this case, they were saying the decision of the Fourth Circuit stands. This is critical because the Simpkins case became the Brown decision for hospitals, and over the next 2 decades was cited in over 260 court decisions. Immediately, the Surgeon General publishes new regulations for the Hill-Burton program, basically saying before you're approved, you have to fulfill all of these rigorous requirements for hospital integration. Similarly, the Leadership Conference on Civil Rights, which is a national group advising Congress on civil rights activities, does an analysis and finds that 10 southern states legally require by law hospitals and healthcare facilities segregate either patients or deny admitting privileges. The U.S. Commission on Civil Rights, which also is a nonpartisan commission advising Congress, does its report in 1963 and finds that segregation is widespread throughout the South. So here we are in the throes of the civil rights movement. We have the death of JFK. We have the rise of President Lyndon B. Johnson. And Lyndon Johnson has said to Congress, we absolutely should honor the president, the slain president, by passing his civil rights bill. Well, interestingly, this civil rights bill was the longest bill debated on the congressional floor, but it passed largely because Lyndon B. Johnson was the master of legislation. He had been Senate Majority Leader for decades and had learned as Senate Majority Leader how to work the House and the Senate to get legislation passed. And he used every tool possible. And as you can see, here we have Martin Luther King sitting as Lyndon Johnson is about ready to sign that legislation. So if we look at the significance of Simpkins, actually we can see Simpkins in Title VI of the 1964 Civil Rights Act. No person in the United States shall, on the grounds of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any federal program or activity receiving federal financial assistance. What does that mean? That meant overnight, 22 federal departments and agencies had an explicit mandate to withhold any funds that were based on discrimination. So we're talking about DEI. This is actually the implementation of DEI. This is saying unless you desegregate, you will not get any federal funding. And as you can see, 5,000 healthcare institutions were now subject to Title VI of the 1964 Civil Rights Act. And what did that mean? That meant non-discrimination in the provision of inpatient, outpatient care. You saw that outpatient wards, those inpatient wards, those had to be changed. They now had to be fully integrated. Non-discriminating assignment of patients to rooms, floors, beds, sections, buildings. Non-discriminatory assignment of employees, medical staff, volunteers. That meant that you could no longer have an all-black cooking staff, an all-black maintenance staff, an all-white physician and nursing staff. You had to recruit a diverse workforce in all capacities. Non-discriminatory granting of permanent and temporary staff privileges. These practices must prevail in all aspects of training. That meant physician, residency, internship, nursing, PA programs, pharmacy, physical therapy, everything that your hospital was offering had to be opened up. It also included dental care. Here's George Simpkins wanting to extract a molar, and that employees and medical staff who had been denied privileges had to be informed of changes, and that dual facilities, if you had a black lounge and a white lounge, those had to be merged. A black cafeteria, a white cafeteria, those had to be merged. So institutional racism had to be a thing of the past. Well, you can imagine that that was something that most hospital administrators, particularly all those in the South, were not willing to stomach. And so the federal government put together a major meeting with 400 of what we would call stakeholders in attendance. And Luther Terry, who was Surgeon General, said, we are going to do this. And in fact, we are going to do this as it relates to also this impending program called Medicare. So Jim Quigley at the time was Assistant Secretary for HEW, and Sherry Arnstein was his special assistant. And they devised a strategy. They wanted to test it. They wanted to see if they could go into these segregated hospitals, particularly medical centers, and see if they could threaten the withholding of federal funds and if that would drive those institutions to radically change their landscape of structural racism. At the same time, here is the NAACP leadership. Here is Montague Cobb. Here is the president of the NMA, the incoming president, all talking with Anthony Celebrezzi, who's secretary of HEW. So this is a network of Black leadership that's calling the shots with the leadership in Washington. So Anthony Celebrezzi addresses Congress and said, wow, Sherry Arnstein under Jim Quigley has gone into 9 southern states, and she's racially integrated 21 hospitals. And in fact, what Sherry Arnstein learned is that if HEW was very clear and consistent, yes, we will withhold federal funding under Hill-Burton unless you comply with all of these standards, those hospital administrators and medical center administrators actually would cave. And in fact, her first hospital was University of Mississippi School of Medicine. Bob Marston had recently been appointed dean. He was an up-and-coming rising superstar. He was a Virginia native, a graduate of VMI and MCV. He was a Rhodes Scholar. He had been an NIH clinical associate. He was on his trajectory straight up. And here comes Sherry Arnstein into his medical center and says, wow, you already have $2.2 million in hand, but you still have $330,000 still due under your Hill-Burton contract, and this also applies to all your NIH funding and your public health service grants. And you're not in compliance because I've already talked to the Black physicians in this community, and I know you haven't granted them admitting privileges, and I know that you still segregate your patients inside this facility. So as a whole, out of a whole series of events, basically Marsden understands that the feds are really serious. Bob Smith is a Black physician in the community. He asked Marsden to do CME at University of Mississippi and is told no. He joins the 1963 pickets against the AMA's failure to grant Black physicians admitting privileges or membership. He contacts physicians in the Medical Committee on Human Rights who are caring for the Freedom Riders who are being beaten and taken to University of Mississippi for care. And he asks physicians around the country to come in and help him try to racially integrate University of Mississippi as well as take care of these Freedom Riders. So basically, Marston holds her ground, and she calls Jim Quigley and she says, I think Marston's going to call you and test this out. Sure enough, Marston calls Quigley and says, what's this woman doing in my office asking me to racially integrate my wards? And Quigley says, well, She's right. We're going to withhold all your funding. And I interviewed Jim Quigley. He said, truthfully, we didn't know if we really had legal standing to do this, but we were trying this out to see if history would prove us right. And sure enough, it did. So essentially, what happens is Marsden Caves, and his first integrated room was with a white comatose patient and a black patient. But he does move forward, and Arnstein is constantly in communication to make sure he implements the other programs. She has learned that the risk when we implemented Brown versus Board of Education in schools, we allowed communities to submit go slow plans. And what that did is it radically slowed the progress that this country could have made in the racial integration of public schools. And Sherry knew this. She was really a young activist and joined the federal government really wanting to be on the picket lines, but she thought it would be more impactful if she was doing what she was doing. And so she realized that if they allowed go slow plans for hospitals, nursing homes, community health centers, again, there would be this really slow delay. So Lyndon Johnson asked John Gardner to become Secretary of HEW. He asked Pete Labasi, and Pete Labasi was Washington's expert on Title VI as it applied to federal programs. And Sherry asked, and Peter Labasi asked Sherry to come in as his administrative assistant. And she says, no glow slow plans. We have to implement this fast, swift, comprehensively. And in the halls of HEW, they were beginning to talk about how they were going to implement Medicare. And she says, bingo. All of a sudden, hospitals are dependent on Medicare income because 25% of their income was written off as bad debt. This meant they would get 25% of their income as paid for if they racially integrated. So she immediately saw the potential of Medicare to radically change the landscape of structural racism in America. Now I actually interviewed every single person on this list except for Arthur Hess, who had died, and Robert Nash, who had died. And it was really one of the most amazing experiences in my life talking to them because they remembered their work implementing Medicare and the hospital integration program as though it was yesterday. And this was 30 years later. Now, I call this the full court press, and they did absolutely every single one of these things. But a key element was on site inspections. There were 8,500s in the country. 8,500s were sent a packet of information. These forms were designed by Sherry Arnstein, who had figured out what she needed to know whether a hospital had integrated or not. And in fact, what they found is that most hospitals actually weren't integrated and they would not comply with Medicare standards and not be eligible for Medicare funding and not be open to the elderly when Medicare became effective on July 1st, 1966. Hospitals in the South were a disaster. And so the federal government decided in order to make this promise happen, they would send teams of people into the South, teams of 2, teams of 3. No one ever went alone because it was too dangerous. They hired 300 people, opened up an entire floor of the Social Security Administration building, and they also recruited volunteers from other federal agencies as well as medical and law students. Everybody went through training. Everyone was taught very specifically what to look for. And the training came from African American physicians who were in the trenches trying to racially integrate their communities. And these are just interviews I had with physicians who had been at NIH who volunteered to go in. And they said these sessions were just so powerful as Black physicians were saying, you know, you've got all the money, but you can't take in a sledgehammer because we really need people to come forward and do this as quickly as possible. So essentially, these training sessions will get the best data possible, send it back to us in Washington, be clear and consistent, and let them know that if you don't comply, you will not be entered into this federal funding door of Medicare. And what these site visitors found is that some hospitals had made, wow, credible changes. And they were ready when that team arrived. Some hospitals needed very minor changes, and they could just do what they needed to do overnight, like Emory or like Grady in Atlanta. One Grady is a U. One half of that U was black. One half of that U was white. Overnight at 12 midnight, the entire hospital flipped and became racially integrated. Okay. Some hospital administrators offered to make changes, but really saying, oh, let me call my congressman or senator and see if that person can work out a deal, because I know that my local community is not very happy about this idea about racial integration. And I know my white doctors are absolutely furious. Some hospital administrators pulled their site visitors and said, I'll be damned if I'm going to have my mother in the same room with a black woman. You don't understand the South. We really get along well with African Americans down here. You just don't understand our culture. And so these site visit teams came back with books and books of notes. And I've actually gone through and researched those notes of these site visitors that went from NIH. Some hospitals even did what they called the Medicare switcheroo, where they'd get their black maintenance staff to be hospitals for just during the hospital site visit, to be patients in a bed. And then as soon as that site visit team left, they would send that black person back out to the maintenance team. So, but fortunately, these site teams had been taught to talk to the locals, to talk to the NAACP, to talk to the local chaplains, to talk to the local physicians, to talk to the local maintenance people, and to find out truly what was going on so that they could absolutely give the most truthful information back to the Washington Medicare team. I will just say that they publicize their programs through local and regional newspapers. The American Hospital Association did a video and sent it to all hospitals in the South. This was a massive, massive, massive campaign. As of June 14th, less than 40% of hospitals were still in compliance. So the White House put together another meeting. And Johnson was at this meeting and said that we're not turning back. This is a centerpiece of my great society. If you don't do this, you won't get money. And sure enough, they had turned the tide enough that the U.S. Public Health Service didn't think that they were going to have to construct backup hospitals, but that was actually in the plan. So Johnson went to the airwaves and he said, gee, tomorrow for the first time, nearly every older American will receive hospital care, not as an act of charity, but as the insured right of a senior citizen. We have made more extensive preparations to launch this program than any other peaceful undertaking in our nation's history. But he also said that this is not going to work long term unless we as a country and we as health professionals and we as a medical profession embrace the need to care for everyone. So Robert Nash, who headed the Office of Equal Health Opportunity within the HEW, addressed the American Public Health Association that fall and actually said, we have turned the corner. We're still negotiating with some hospitals. Some hospitals were so small and they were in such deeply racist parts of the country that they said they'll never comply. But he said basically across the landscape of healthcare, thousands and thousands of hospitals have opened up to Blacks and other minority groups who are being assigned rooms on the basis of their medical needs, not on the basis of their color of their skin. So like every era, there was pushback, and it's important for us to understand the nature of that pushback and the response. And sure enough, Southern senators, John Stennis from Mississippi, chair of the Appropriations Committee, which is a hugely powerful committee in the Senate, attaches a rider to the appropriations bill. And it allows physicians to be able to continue to segregate patients based on what they call their medical need. The response was swift and vocal, but Stennis said, unless this amendment goes forward, I will slash all the funds to HEW and integration funding as part of the appropriations bill. So what happens is Gardner agrees to Stennis's demands in order to preserve his agency, but the cause was not lost. And in fact, the NAACP was ready. George Cypress was a pediatrician. Waldo Scott was a surgeon. Both were in Newport News, Virginia. They had applied for admitting privileges to Riverside Hospital. They both were denied. Riverside, interestingly, was approved for Medicare. What the NAACP team did is they sent down people to actually shadow George Cypress and Waldo Scott for an entire week. And they sent the country's expert pediatricians and expert surgeons. So here they got, as part of their case, expert testimony from nationally ranked pediatricians and nationally ranked surgeons that the care that these physicians practiced was not only exemplary, but they were also exemplary role models. And so the NAACP was very ready. And of course, their case was dismissed at the district level. But when they appealed to the Fourth Circuit, which had overturned the Simpkins case, once again, Chief Judge Simon Soboloff wrote the decision and said, yes, we are upholding the Medicare hospital racial integration guidelines. And we are forcing Stennis to back off. Those amendments will be rolled out, will be removed. And in fact, what emerged was an even stronger racial integration platform than had existed before. So the district judge asked whether it's discrimination per se merely because a hospital has deemed it fit to place white patients in one ward, Negro patients in another ward. We answer that it is. Our holding is simply that race cannot be a factor in admission, assignment, classification, or treatment of patients in an institution like this, which is state supported and receives federal funds, since the law forbids the treatment of individuals differently or separately because of race, color, or national origin. And he went further to say all the training programs had to be open, admitting privileges had to be granted, and that this activity of Riverside had to be shut down. So the story doesn't end. And as you can imagine, Jean Cousert, who was an internist in Mobile, Alabama, was found killed in her front yard when she is disseminating information about racial discriminating patterns that are persisting in her community of Alabama. So it didn't end easily. Some say it was a quiet revolution. I think it was quiet in some ways and really tragic in others. But what's important for us to realize is that those integration funds dried up immediately when Lyndon Johnson left office and the Republicans came into office. All of the Office of Civil Rights was basically gutted. So the implementation of racial integration did not continue into mental hospitals, did not continue into nursing homes, and did not continue into physicians' offices. So in summary, and we'll have 10 minutes for Q&A, the legal foundation really rests with Simpkins. The legislative foundation really rests with Title VI of the Civil Rights Act and subsequently Medicare's adoption of those integration standards that come forward from Simpkins into the Civil Rights Act, into Medicare. I say that third component of the perfect storm is the Johnson administration's commitment to civil rights. The Office of Equal Health Opportunity and the Office of Civil Rights, their new strategies of putting boots on the ground, collecting data, consistency of message was critical to getting the story at the local level in a way that people would adhere to. And that we have to come back to the courts where the process started in 1956 with James Walker Hospital in Wilmington, North Carolina, and say that without the courts, this would never have been maintained in the way we see it now, and that we would have had further pushback if this process hadn't been solidified. And I would still argue that the effort to racially integrate hospitals, health professions, schools, professional societies did not end with Medicare. It was executive order, executive order, executive order, executive order to racially integrate medical school faculty, executive order to adhere to these standards, that a lot of changes that kept going forward, we saw with affirmative action and now DEI programs under Obama and Biden, were really the continued fulfillment of this promise toward equity. And with that, I will stop talking and take Q&A.
Thank you very much, Dr. Reynolds, for that very informative and engaging talk. At this point, the chat is disabled, so we'll take questions through the Q&A section of Zoom.
And do you want me to stop sharing so we can see everybody?
Yes, we can do that. Thank
Okay.
you.
Okay, so there is a question in the chat, in the Q&A. Dr. Reynolds, do you see this precedent being able to be used by the court to protect equity across all sectors in the current landscape?
I would love to see the courts become quite active. I think that what this Medicare story tells us is that you have to use every lever possible, whether it's a legislative lever, whether it's a court lever. The courts are now fighting back. We see, the courts have filed an injunction against birthright citizenship. The courts have filed an injunction against freezing of NIH funding to the 15%. Courts, but on the other hand, we now saw yesterday protests, yesterday and the day before, against the dismantling of the Federal Consumer Protection Action. So I think it's really important for us to understand that in order to move 2 steps forward, 1 step forward, 3 steps forward, you have to have boots on the ground in terms of activists. You have to have a legislative agenda, and it is not, I am certain that people in the House and Senate who are opponents of DEI and integration are preparing for when the day comes when they will be able to put their legislative platform into the docket to be debated. But we have to have the court system. And the trouble that we have is that our Supreme Court is conservative. On the other hand, you've got all these federal districts, and not every federal district is as conservative as the South or Texas. There are some federal district courts that are more liberal. And so like the case that came out of Boston yesterday to freeze NIH payments, and to freeze the federal government's efforts to only pay medical centers 15% of their NIH, whatever, so those are coming forward from more liberal districts. And I would hope that we would see more of that activity.
Okay, we have another question. when you interviewed these historical figures, what common threads did you find that might inspire or motivate us today?
Wow. Well, the consistent theme that came through is that people went into the Kennedy administration and the Johnson administration because they wanted to contribute to changing the landscape of racial segregation in this country. Jim Quigley had been a Pennsylvania congressional congressman from Pennsylvania. And he had gotten his colleagues to sign a letter to Eisenhower criticizing Eisenhower for failing to move quickly around the Brown versus Board of Education Act. And when Kennedy was elected, he said, I'm going to move from my role as a congressman into the administration to see if I can have an impact in now racially integrating public schools. And in fact, he hired Sherry Arnstein, who had been involved in racially integrating Alexandria General Hospital in the late 1950s, early 1960s. She was a journalist with White House credentials, was going into the White House, doing her publicity and her journal writing, making connections to people in the New York Times, the Wall Street Journal, the Washington Post. So when she got hired by Jim Quigley, she had a lot of press credentials and connections. She also had had this experience integrating Alexandria General Hospital. And she could see immediately what Quigley was up to, what Quigley envisioned in public education. And then they started talking about implementing it under the Hill-Burton program, which is where she started. She started hospital by hospital under the Hill-Burton program, and then came along Medicare. But Quigley was an activist. Sherry was an activist. Pete Labasi was an activist. Jim Gardner was an activist. John Gardner said to Lyndon Johnson, I will not become Secretary of HEW unless you agree to fully integrate America's public institutions. Pete Labasi said to John Gardner, I am not willing to oversee Title VI integration unless you are willing to withhold federal funds. So the thing that is so inspiring is these people left their jobs, they took different positions, they went into administration to make change. And they all saw themselves not acting as individuals, but acting as a team with a common vision, with a common goal to serve the American public. And so I tell you, one of the best research programs I've ever done in my entire life is actually interviewing these people because they were so deeply committed to serving the American people and to using their energy to accomplish a bigger goal than just what they themselves might be able to do.
Thank you. All right, I think we might have time for one more question. Does the anti-discrimination provision of Medicare apply to private physicians, mental hospitals, and nursing homes, or only hospitals?
It's a great question. So one, it took me years and years and years and years to get into the AMA records. And I had been told this by the people I interviewed, that the AMA was adamant that the only way that they would support Medicare's passage is if Lyndon Johnson agreed to not use Medicare's payments to physicians to racially integrate physicians' offices. And so the extent of reach of Medicare was not universal. And the only way to it applied, you could say, well, how effective is it now? Well, nothing is supposed to be racially segregated. It's against the law to racially segregate. But they were limited in how much they could extend the reach during the implementation of Medicare. They could integrate outpatient clinics in hospitals, in community health centers, but they could not go into private doctors' offices who are being paid for physician care under Medicare. And I did find those records in the AMA files finally after decades and decades of asking permission to do the research.
Oh, excellent. Thank you so much, Dr. Reynolds. This has been very educational for me and informative. Thank you to our audience for taking this time to come and listen to our first Black Health Story Month lecture. I hope you all have a great afternoon. Thank you all. Bye.
Bye.